Good afternoon, and thank you for joining the National Commission on Correctional Health Care, NC20 National Conference on Correctional Health Care. Today we have a very exciting panel on monitoring, an essential component of health services. We're joined by a group of experts. We'll do introductions in just a minute, but very briefly, Sheriff Arnell Lucas, the Sheriff of Milwaukee County, Inspector Aaron Dobson, the Jail Commander, Mr. Oscar Aviles from Hudson County, New Jersey, our Assistant County Administrator, Mr. Don Batista, Assistant County Counsel, also Hudson County, New Jersey. I'm Brent Gibson. I'll be your moderator, joined by Jim Boissard. Today, our learning objectives you can see on the slide. We're going to talk about the importance of contract monitoring and explore three distinct models of health services monitoring, three technical areas where monitoring services are utilized, and we're going to cite three potential benefits of monitoring activities. I am an employee of the National Commission on Correctional Health Care, and that is our sole disclosure for this morning. So again, let's do some quick introductions. Let's start with Sheriff Lucas. Sheriff, we're very happy to have you join us today, and your career is illustrious and long. It would take all of our time to discuss the great things you've done, but you are a true Milwaukee native and local, and have done some amazing things, including working for Major League Baseball, where you ran security. You are currently the 65th Sheriff of Milwaukee County and have also been a police officer. So Sheriff Lucas, anything brief you'd like to say for introductions before we go to the other panelists?
I'll just say I'm proud to be a colleague of Inspector Aaron Dobson because he is someone that's truly a pro when it comes to jail and inmate care. So I'm very proud of being a part of his team.
Thank you, Sheriff Lucas. It's been a pleasure. I've had the pleasure of meeting you several times. Very humble and professional man. We're so grateful for your time today. And just for our audience, every county in the U.S. is a little different. Milwaukee County follows a reasonably common pattern where the jail belongs to the sheriff. We're going to see something a little different with our colleagues from Hudson County, but the jail commander, the current command falls to Inspector Aaron Dobson. And Aaron also worked with you for some time now, but would you mind giving us a little bit of introduction to your also illustrious career? The mic is open.
Good morning, Dr. Gibson. There's a little technical issue there. But no, I've been with Milwaukee County Sheriff's Office for just about 22 years now. My first 5 years with the agency, I spent working in the jail as a deputy. So I got a lot of great experience there, and it was a great basis for the beginning of my career. After that, I did a lot of work in the patrol division, criminal investigations, was promoted several times, and have spent the last 3.5 years as the commander of the Milwaukee County Jail. And I'd like to say, first and foremost, it's great to work for a sheriff who really understands the true priorities of a sheriff and understands the importance of the safety and security of not only the staff, but the inmates that we're entrusted to protect and keep safe every day.
Thank you, Inspector Dobson. And working with you for many years now, I can say that you really live those values and are involved at every step of the way. We're going to turn now over to the East Coast to Hudson County, New Jersey. And for those of you who don't know, Hudson County is immediately west of Manhattan, and the area has been in the news with the recent COVID challenges, and that jail has been front and center. Joining us today are Mr. Oscar Aviles and Mr. Don Batista, offering two different perspectives. Oscar is the former jail commander for Hudson County, and Mr. Batista, Don, is one of the county attorneys. And Oscar, would you mind, each of you, Oscar and then Don, please tell us just a little bit about yourself and your perspectives. All right. Well, we may be having, again, a little bit of sort of mic challenges. This is the case that we face sometimes nowadays, but we'll be sure to hear back from Don and Oscar shortly. I did want to also mention Oscar serves as one of the board members for the National Commission on Correctional Health Care, and as such really provides some national leadership. All right. We're going to get started now. Again, I'm going to ask some questions, and contract monitoring is something that many people know about. It's pretty commonly done where a very technical service is contracted out, whether it's food service, uniforms, air conditioner repair, whatever. And it's not uncommon to see jails contract out their health services. But like other technical areas, it may not be obvious or clear what makes a good health services program. And so this idea of monitoring has become more and more prominent as the years have gone by. It probably is fair to say it started out as more of a traditional fiscal monitoring, making sure the bills were correct and people were delivering the basic services that they said they were doing. But in healthcare, which is a very complicated thing, you really need some technical expertise. So we would like to hear from both of the jails we have on today a little bit of your experience here with contract monitoring. For Hudson, where we'll turn to as soon as the audio is up and running, we've had some experience monitoring them for really about 3 to 4 years now, and just a little bit less time with Milwaukee. And I did want to say the reason we feel very comfortable talking about this is both of these counties have turned to the National Commission to provide these services, so that we're being totally transparent. But Aaron or Sheriff Lucas, what does contract monitoring in this setting mean to you? Please just tell us your thoughts.
I'll start it out. For us, it didn't start once we had a vendor in-house. Contract monitoring started for us with the process of issuing an RFP, such that an RFP was put together in conjunction with the monitor, NRI, to help us ensure that we receive the high level of medical care, dental care, as well as mental health care here in our facility, which are so important these days. Us not being medical practitioners, and none of us on staff here at the Milwaukee County Sheriff's Office, it's critical to have that expertise helping ensure that the RFP was appropriate, not only in terms of what it was asking, but also the proposals that were received. They were complete and thorough and would provide the quality of care that we so desperately needed here in Milwaukee County. And then once we acquired a medical provider, having that monitor can help us ensure that we're receiving that high level of service that is so critical in Milwaukee County. Just as an aside, prior to my coming to office, for an 18-month period, there were 7 people that lost their lives here in Milwaukee County Jail. And so it was very important that we get it right. The previous medical provider just was not providing the adequate care that was necessary for us here in Milwaukee County. And thus having a monitor along with finding the right vendor has now put us on the path to, I think, providing the high level of medical care that the taxpayers and the people of Milwaukee County truly deserve.
Sheriff, that's fantastic. And I do know exactly the incidents you're talking about. And that was one of the things that got on our attention as the national, literally standard bearers for correctional health care, is these are the things we don't want to see. We've been doing this long enough to also know that I think it's fair to say there's a lot of finger pointing when there's a bad outcome. And it becomes then a little harder to sort out what's actually going on. And so I really appreciate that perspective. Turning to Inspector Dobson, Milwaukee is an unusual situation, to say the least, in terms of how pretrial detainees and those who are convicted of, say, lesser crimes or shorter sentences are housed. Your perspective is from the jail commander. Tell us a little bit more about what that level of complexity is and how it is helpful to have someone there sort of sorting out patients and care as we go. We'd love to hear your perspective.
Right. Thank you, Dr. Gibson. And you're right. We work in a very complex environment. And as everyone knows, correctional health care is complex in and of itself. We work in a facility where we bring in 85 new inmates every day, and that's pre-COVID numbers. However, we're still quite busy even with COVID. We have a separate county facility where we ship lower level prisoners or sentenced prisoners to. So there's a lot of movement, a lot of people coming in and out of our facility. We have about 32,000 people coming in and out every day, and each and every single inmate needs a good evaluation at the front door. We need to assess, is that inmate okay to come into the facility, number one, and number two, how do we give that inmate or patient the appropriate amount of health care while they're here? Make sure that they're safe, because at the end of the day, there's nothing more important than that to us, is personal safety for our staff and for the population who we're sworn to protect. And it's a complex job because a lot of the people coming off the street have very complex both mental health and medical issues. And we have to assess that, and the medical staff has to assess that. And it's important for us as a security staff to be able to oversee our private vendor, our medical vendor, to ensure that they're doing the right things for the right reasons. And how do we do that? We have a contract with a contract oversight, committee and group of people who help us ensure that they're doing the right things. It's a very complex issue, and it's a very comprehensive solution to a problem that we all face across the country. And at the end of the day, how can you ensure safety if you don't have a good medical and mental health program? You can't in a correctional setting. So I think it's essential not only to have a good medical vendor, but to have someone on your side to help you oversee that medical program. Because I see, even though they're a vendor of ours, they work for us, they're part of us. They're part of the security team. They're part of the team ensuring safety and security. And so is the contract oversight team. And when you can all work together as a team to ensure safety, I think it gives us a good amount of comfort in letting us know we're doing the right things.
Fantastic. I really appreciate that. And I'm going to just do a quick test to see if our folks in Hudson County are available, because I want to ask them the same kind of questions. I want to talk a little bit about their history as a jail. Oscar or Don, are you able to hear me, and can you respond? All right, they may still be having some audio difficulty. They are joining us today. What I can do, and if a monitor is worth their salt, they'll be able to talk a little bit about the operation. I can tell you, similar to Milwaukee and Hudson County, historically, there's just been some challenges with healthcare delivery over the years. And I think, Don, you may be on audio now. I just want to check. Don, can you speak? Okay, that's fine. So one of the things that happened in Hudson is the community was very concerned about quality of care. I'm sure you've seen this in Milwaukee as well. The community was very vocal. There were calls for reform is probably an extreme way of describing it, but there was a lot of concern over both deaths in custody, suicide, and a variety of things. And one of the things that was decided early on is that there was a need for some sort of outside expertise. And Don, I do see you there. And Oscar, are you able to hear me now? Is your audio working? Okay, can you do a quick test? We'd love to hear about your experience from you directly. Can't hear you, Oscar. You may still be on mute. All right, we appreciate everyone's flexibility today. The world of technology is challenging across all aspects of every business, as I've seen firsthand. But again, Don and Oscar, we can see you, but we can't hear you. That's okay, not a problem. So one of the things that was done in Hudson County proactively is to bring in some area of expertise. And I think it's fair to say that it's really Oscar and Don who got us thinking as a not-for-profit company, how can we do a little more? How can we provide those monitoring services? And again, working closely with county's legal leadership, Don, as well as county administration, Oscar, we were able to work very closely with the jail commander to provide services that are needed to assess the complexity there. What makes Hudson a little bit more complex is there's a high number of federal detainees there who kind of, it's not that they fall under different rules, but it's a different situation than you do when you have strictly local folks. I'm going to turn now to talk to one of our learning objectives before we move to our next question. We asked you as learners to describe 3 distinct models of monitoring, and I want to take this opportunity now that we've heard a little bit about these 2 jails today to describe what we've seen in terms of monitoring. One model is that it's kind of self-monitoring. A county or a state will monitor itself. which is certainly a very noble effort. But generally, when you monitor yourself or something, speaking from experience, you may get a different perspective than when you have a third party or a peer review. As a physician, I may think I'm practicing great medicine, but when, say, Dr. Voisard takes a look at my patient outcomes, he may say, Dr. Gibson, you really could do better. And that's called what we refer to as peer review. In the monitoring world, it really helps to have that outside expertise. So if what we do is third-party monitoring is one model, self-monitoring is another model. The third model is where you have kind of a limited or focused effort of monitoring where you're looking at a very specific or limited number of things. Don and Oscar, if they're able to get on, can possibly comment on that. I think they've tried this model in the past. But that would be, for example, where the sheriff says, Sheriff Lucas might say, I'd like for you to look at these bills and make sure they make sense, or I'd like for you to look at one very specific thing. And then very strictly speaking, contract monitoring, which is something I've seen very commonly in federal contracts, for example. But those are three examples of contract monitoring. What I think makes monitoring different in these two jails is that it's a really comprehensive approach from kind of top to bottom. I'm going to turn now. We're still in our first area of discussion, but Mr. Jim Voisard, who's only with us for part of today's presentation, but he plays a really active role in monitoring, really especially in Milwaukee. And Jim, in your own words, how would you describe what monitoring does and how it's different from some other things you've seen?
And I appreciate that. I've had the fortune of being able to see a lot of facilities across the country, jails, prisons, and juvenile facilities, and I can tell a distinct difference when there's some sort of a monitoring process, which really has to start back all the way to the RFP development and what's in your contract that you ultimately sign to be able to have the on-site contracting. But it does make a difference when you have a third-party, neutral, if you will, type of an oversight, a monitoring process in place, so that you not only look at the compliance indicators that are required by the contract, but also if you're required or as part of the contractual agreement to attain a National Commission accreditation, which we hope that it is, you can not only monitor that progress towards getting to that ultimate goal, but also the monitoring process, in my opinion, should be looked at as a collaborative effort. Even though we actually are hired, technically contracted with the county, with the facility, the entity, it really needs to be a collaborative effort where there's open communication, collaboration between not only the security component at the facility from which we're hired, but also an openness and communication with the healthcare professionals that we're there to interview and observe and monitor. And altogether, this third-party expert input is definitely beneficial to all parties involved, not just NRI, not just the facility. It ultimately produces a better outcome as far as provision of health care and an appropriate environment in which facility and healthcare staff work. We're all after the same thing, so we should be able to go out about it in a collaborative effort. You have the accountability. The monitor is there to collect facts and analyze data and information that's collected. So the healthcare professionals have to live up to their obligations. But when there is something detected or come across as far as a trend or maybe a slippage in a particular area, whether it's documentation or timelines or what have you, then the monitor can be there not only to point that out, but also to assist with resolving that issue before it gets out of hand. So I look at it as a real positive approach, ultimately not just to the monitoring, but also a great assistance to improving the level of care within the facility.
Thanks, Jim. That's really good perspective, and I appreciate that. Well, let's talk about, we're going to shift to area of discussion 2. we're all familiar with monitoring. We talked about that, or I should say court monitoring, and I think many of our nation's jails have experience with this. And typically there's a group of experts that periodically come in and make assessments, a written report. What I've seen, and a concern is always that these, and we're not speaking specifically of anybody involved on the call today, but some places I've seen in other parts of the country over time, even some years ago, the relationships turn into not one of collaboration, but one of kind of gotcha. And earlier in my career, I was one of these people. It was in my military days, I did a lot of work with various operations where I had to be the inspector general, if you were, or his representative. And it was sort of a, you know, what can I find that's wrong? And I think I've seen a little bit of this in our world of correctional health care. But in both of these cases, you all initiated the monitoring yourself. You had the foresight to do a little bit extra. And I'd love to hear, let's say from Sheriff Lucas to start, in either here or in other experience, what's the motivation behind self-monitoring? Why would you ask somebody to kind of look into your business and maybe give you some things to think about that you didn't want to hear?
Well, thank you again, Dr. Gibson. Ironic as it is, we're an agency that actually are under both. We currently are under court monitor. And I can say prior to our administration coming to office, that relationship was not necessarily the most collegial, most collaborative. I think with the administration coming in 2019, the leadership of Inspector Aaron Dobson, and certainly a team that was willing to work with the monitor and the court, we've gotten things figured out. We work collaboratively together, and are hopeful, if it were not for the misfortune of COVID, that we could have possibly be looking at maybe the lifting of that order. Having said that, though, at the same time, the virtue of contract monitoring, though, are many because they ensure that we our quality improvement is ongoing, that we're making the progress that we seek, and the relationship is one that's collaborative in nature. Again, they're having the professional expertise that does not exist in the Milwaukee County Sheriff's Office. It's just so helpful to our being able to deliver the level of services that we do to those that are entrusted to our care. So having that team of monitors who are competent, capable, have our best interests at heart and at hand gives us another tool here at the Sheriff's Office to deliver the high level of service that the people of Milwaukee County expect of us.
Thank you, Sheriff. And I can say without a doubt, we know that you and your team view yourself as part of the public health infrastructure, if you will, and that's just a key role that perhaps was not traditionally one of law enforcement, but is now front and center, whether it's mental health, drug addiction, or COVID. What you do affects everyone else. And something you said, I think is a great launching off point to this idea of collaboration. And Aaron, or possibly Jim as well, can comment. When COVID sort of, started flaring up in our nation's jails, I know that Milwaukee was right on top of how to, both Hudson County and Milwaukee very much on top of how to contain this, if you will, within the walls. And we had we had some technical support conversations about inmate movement, which is, I think, really critical. And I don't know, Aaron, if you want to comment a little bit about that. Did you find it helpful to have some national experts? A loaded question. Did you find it helpful to have some national experts in your pocket to handle questions about inmate movement during the COVID pandemic?
No. Absolutely, absolutely. First and foremost, we have a phenomenal chief of staff, or the sheriff does, who was talking to us about COVID probably back in January and February. So I think that really helped us be on the forefront of the COVID issue. And in working with our contract monitor and having those, professionals in the field to give us some advisement on what the right things to do were. Because, I mean, just think about what we know about COVID now and how much more it is than we knew back in February and March. And to have, you know, doctors to reach out to that were experienced in the field really helped us create a safe environment. Regardless of COVID or a complaint from former staff or from family members, it's great to have someone on our side to reach out to give us professional advice that we can rely on and trust. It's been so beneficial to us through these challenging times. I can't, you know, say enough good things about, you know, what the contract monitors have done for us to create that safe environment. I mean, I think through the first probably 3 months of COVID, we had no positive cases. And it was through the help of the contract monitor and other entities where we were able to devise a comprehensive plan to help ensure that we were doing things the right way. And, you know, we've had a decent amount of positive cases come in, but I think it's important to identify those cases, quarantine appropriately, and to have medical professionals on your side who really give you good advice. And it gives us a great level of comfort to have that. And knowing we have that in our corner is just been extremely beneficial to us.
Thanks, Aaron. And Jim, I know you've been involved in many of these discussions. I'll talk a little bit about Hudson County and what some of the things we saw there. The jail commander, who is not with us today, he was very much on top of COVID, and also, in addition to is taking immediate safety measures, was very concerned about how to continue to provide services for inmates, visitation, legal services, those kind of things, as well as continue monitoring in a remote capacity. You heard Jim Boissard talk about jumping over to a virtual survey. Lots of us have had to figure out how to carry out our business, if you will, in a virtual environment. And I think what we saw in Hudson County was an excellent job where monitoring continued during even these early months. And what was also interesting to see is that the jail took a very proactive community forward look, because we also, many of us have heard about the decarcerate movement that was kind of connected to COVID. And well, it doesn't take much to see that if you are going to release a bunch of folks into the community, you need a bit of a handle on the healthcare of those people, because it'll no longer be the jail's healthcare responsibility, but the community. And if there's an infectious disease component of that, or even simple chronic care, that needs to be taken care of. So Oscar and Don, again, who are with us on the call, they were able to very quickly see not just the physical infrastructure of how housing would work for these inmates, former inmates, soon to be former inmates, but also making sure that folks weren't released that had some kind of infectious disease risk to the community. I think the reality in the ground from what we have seen on the ground is a bit of a contrast from maybe what we see in other sources about how correctional facilities are these super high risk environments. It's not that they're not, but they're also very well managed environments where infectious disease and containing outbreaks is almost day-to-day business, meaning you always have to be aware of that, because by nature you're operating in close quarters. And that includes both inmates and staff who also are sharing the environment with patients. So clearly those things are very important. So it's been, I think the COVID pandemic was really a stress test of the ability of jails to pivot and provide expert health support during a crisis. And at least from my perspective, having the healthcare expertise there, independent from the health vendor, really just provides that extra layer of support, if you will. So I appreciate all the comments we've heard on that. I'm going to turn to one of our learning objectives here, and I think it ties into this, and it was three technical areas where monitoring services are utilized. And Jim, I'm going to ask you, just if you don't mind, to speak to this briefly. And what I'm getting at, Jim, is you probably in the course of your work in both of these jails have kind of focused in a couple of areas. Would you like to comment on some of the technical areas where you have provided expertise, you and your team members?
Sure. Yeah, we focus. I mean, when we utilize the terminology healthcare as a universal encompassing term, you have the medical component, the mental health component, and the dental, and then the community. As you referenced, Dr. Gibson, there has to be a connection with the community resources and so forth. But really looking at not only the healthcare record, which we tend to have access to in a remote via technology, which is great because we're able to keep tabs on things and monitor things as we go along, but also looking at timelines. Access to care is the -- issue that you have to have. If you don't have access to care, the rest of it's kind of a moot point. But when you have good access to these different healthcare resources, then you have to look at the timeliness of that access. Just having access and being able to, for an inmate patient to request services, if it takes 2 weeks to get to them, to even do a basic patient triage, that's not appropriate. So we look at the access, we look at the timeliness, we look at the continuity of care from the time they enter till the time they're released. And that becomes a component of discharge planning to make sure that we're just not saying, in the early days, pretty much we said, okay, court says you're released, here's the door. You know, you're on your own. No medications, no warm handoff, no connections with appointments that they may have already had established. So there's a lot of things that you have to look at. And I think the three most critical are access, timeliness, and continuity. And you look at those not only through healthcare record reviews, you look at through documentation review, you look through continuous quality improvement reviews, where you really get down to the nitty gritty to look at all the different parameters of all the processes and the patient outcome. It's great to have a super duper 100% compliance on a process, but if the outcome of the patient care is not where it should be, then you've got to go back in and look and adjust your process to be able to get the appropriate outcome. So that's extremely important. And the education of the patient also, we literally have a captive audience. So this is a great time for healthcare professionals to do some education. A lot of these individuals, unfortunately, when they're out in the community, do not have good access to care, or don't avail themselves to the care that may be out there in community, in the clinics and so forth. So being able to get them to understand what their healthcare issues are, why the medication, what it does, and how it's effective, and the importance of compliance with taking your medication. And the better you can inform somebody about their healthcare disorders or diseases, the better prepared they are to take care of themselves when they're out. And unfortunately, we do have individuals who use, in some sense, the revolving door, and they do come back to visit us occasionally. So we have found that when you educate people and you provide good, appropriate care and good discharge planning, when they come back in, if they do, you're not starting back at square one. We've actually seen improvement in self-care. So that's extremely important. So those are the areas, and observations. We go on site, we do the remote reviews, but we also do on-site information to look at how the processes are, how patient flow is, how the communication and cooperation is between security and healthcare individuals, because all that plays into having an effective system. And at both locations, and COVID has really shown us, heightened the awareness of the need to go about these things on healthcare as a team approach. It's not just security, safety, security, and healthcare. You do your thing. It has to be a joint effort to be able to get the eventual outcome that we're looking for.
Thank you, Jim. That was really helpful and a great perspective. And you've been doing this a long time, and you've seen, from the beginning till now, things have really come a long way in the field. And it's thanks to efforts of all the people on the call today that have that vision for healthcare in a correctional system. I'm going to call on Hudson County now. Don and Oscar, are you able to hear me okay? Okay, can you unmute let's unmute you and see if you can go ahead and comment. Looks like you are muted.
We are.
Okay, now I heard you. Perfect. Excellent. Well, we're going to do everything, a couple of things here since you're with us, and we're really, really grateful for your time today. I know how busy they are. If you could do just some really quick introductions for both of you. And then Oscar, if you'd like to speak a little bit about your experience as jail commander before assuming your current position. And then little bit of the history of the jail in Hudson County and your experience with monitoring, as much as you can do in the time we have today. We'd love to hear from you.
So my name is Oscar Aviles. Good morning, everyone. I'm retired Director of Corrections at Hudson County, New Jersey. I started as a correctional officer. I worked my way up the ranks. Retired at 15, came back to county government in 2016 as Assistant County Administrator. Upon my return to Hudson County as Assistant County Administrator, one of my responsibilities was kind of like an oversight of the correctional facility. And during that time period, during a 12-month time period, we had 6 deaths in the correctional facility, 4 within a 3-month window. Prior to retiring, we were NCCHC accredited. Thought we had a really good medical program there. Obviously, things fell through the crack. And we enlisted the services of NRI to come help us look at what we were doing and help assess our medical program, make recommendations, and continue monitoring for us. I know I'm saying a lot in a short window, so I'm just trying to get some of the main points as to why I believe what NRI does is important. We haven't had a death since, and they've been with us for 3 years. We've recently just got reaccredited to the NCCHC, and although they helped us so much in improving our medical program, and they're still in there finding things that we need to improve. So I just wanted to stress that.
Thanks, Oscar.
Thank you. I'm Don Batista. I'm the Hudson County Council. I apologize for the problems, but we were just adding some money to Brent's contract so they can get a better system for these webinars. But I can't add much to the technical end because all who are on the call are probably more conversant in this than me. But I had been in private practice for a number of years, came in with government, and I understand the issue in government is getting the lowest price for the product. I don't believe that makes sense when we're talking about medical issues. What we did in Hudson, and I would urge you to discuss it with your respective council, is we created a committee of the freeholders and the administration, and we invited the players in the community, in the medical community and correctional, to come in and make a presentation. We then evaluated people not just on price, and we committed to them that if they performed, we would stay with them. We have been working on a 1-year contract over the past, I guess this will be the 3rd year we're going into it. And then, because I believe the industry is fraught with problems, just the nature of the beast, is that we brought NRI in as the stick to let them know that we were watching. And so far, knock wood, it's worked. I think we have a good relationship with our medical provider, but our medical provider also knows they're on a very short leash, and the problems that we previously experienced, we will not countenance. And they know that there are eyes watching over them. And I don't believe, given the nature of medical services at a correctional facility with the problems that are generated just by your population, operating without having that stick is a prudent way to proceed. And so I am totally enamored with the way we're doing it. And that's, I know I tease Brent a lot, but they do a great job. They're totally responsive, they're cooperative. And so far, as Oscar said, knock wood, we've not had a serious incident.
Yeah, I just want to add that because of the deaths in the correctional facility, Hudson County, New Jersey, obviously is a very progressive county, and we do a lot for our citizens and for the correctional facility. And the advocacy community really speaks loud in Hudson County. We have a contract with Immigrations and Customs Enforcement, and we have a contract with U.S. Marshals. And when something happens at that jail, because of the current events, these advocates are really local. Those 6 deaths did not help us. You know, one thing that we're able to work out with NRI is part of addressing the issue that was going on at the correctional facility was the creation of a correctional advisory board. Our county executive, through executive order, created the correctional advisory board. I chair the board, county council sits on it, as well as the advocacy community. We meet with them to discuss the issues, and NRI is a big part of that process, including the medical vendor in the correctional facility. We hired an advocate to go inside the correctional facility to be on a contract to go in there and tell us what we're doing wrong and to deal with the grievances as it relates to the medical component. Obviously, there's releases that need to be done. I say that because we share the NRI reports, the monthly reports that we get. We share those reports with the advocacy community, and we share that with. It's very transparent. Correctional administration sometimes gets a little bit tight about that, but it's understandable. Nobody wants to be over their shoulder at all times, but it keeps the vendor on their toes. It really does.
Yeah, and not to take up too much time, I echo what Oscar has said. I'm a child of the '60s, so there's a certain view of government that I think the public carries with them, and we're fortunate we have a county executive who's very progressive, and we try to embrace the public. We try to embrace the advocates. We bring them into the tent, and if we can't defend to them what we're doing, then we're going to have a hard time selling it to the public. So we invite their comments, and so far we've had a, knock wood again, I'll use that term, we've had a good relationship.
Yeah.
Thank you, Don. That's really helpful information. I think our audience has heard two really different experiences, two different parts of the country, and I think it speaks to the ability of monitors have to be nimble. Oscar used the term freeholder. That's essentially the same as a supervisor in Milwaukee. So the point of mentioning that is it provides reassurances, I think, to locally elected officials, many of whom are part-time, many of whom are other professionals such as physicians or lawyers, and they don't, they want to get the work done for their citizens, and they don't want to be frustrated by some of these essential functions of government. What we've been able to do in the case of both counties is provide, again, directly to the county leadership, either the elected executive or the elected legislature, if you will, medical detail in a way that is understandable and that they can provide assurances to their citizens that the jail is living up to its constitutional obligation to provide health care. That's easier said than done, because we all know there's this sort of constitutional threshold out there, and as an attorney, Don, you know what I'm getting at, but what does that exactly mean? Well, I tell you what, I'm going to quote Aaron here, because he said something to me the other day that I think really speaks highly of how that jail operates, and it goes for both of these jails. He said to me, if I hear that they're getting better care on the outside than what I can do on the inside, I'm concerned. And I thought that was very progressive. We talked about progressive in Hudson County. Milwaukee is also a very progressive county. And I think, what that means to me is you don't want to go into like a jail and your healthcare goes into a black box. You don't know what's going on. You come out the other side in worse shape. And it's only the attitude of leadership that makes that difference. And monitoring it, Don used the term stick, and I appreciate that's Jersey for helpful advocates. But the point is, I think you can hear how that's sometimes the role of the monitor, but also one of collaboration. If you were to speak to everyone who's been involved, we really are very interested in getting to the truth, if you will, the facts. And it's no benefit to anybody if there's just a series of people getting thrown under the bus for this, that, or the other, because healthcare is complicated. And I think sorting through those facts is really important. I'm watching our time here, so I'm going to make sure we've talked about the third learning objective. I think we've already spoken to. It is cite the 3 potential benefits of contract monitoring services. So I think we've covered that. But what I want to do is we wrap up here, and I know Mr. Voisart has to leave. He has other duties pressing on him. We're very fortunate. I know everyone else does as well. But if anyone, and I'll open this up to the group, anyone have any specific observations that you have, things you've learned about from your monitoring activities that you would just not have seen were we not there? Does anybody have an example of that? Something specific, let's say?
I would say the chart reviews. As correctional practitioners, you're not looking at those medical files, and then you don't know what you're looking at. To have the benefit of chart reviews even remotely, and having the ability to communicate with the monitor to tell you, listen, you have a problem. and you need to look at these issues. And what's good about it is that it's instant. As soon as the chart review is observed and there's some discrepancy, we get notified right away. So it's a good thing. And that's something that, as a correctional administrator, I wouldn't know where to begin.
And if I'm sorry, if the inspector wasn't going to say it, and I'll be very brief, I could just point to, we briefly spoke about it, COVID. Early on in the pandemic, we were receiving recommendations from NRI to implement at the jail, and certainly Inspector Dobson can speak to it more specifically, that I think made it possible for us, as the inspector indicated, to get through the first few months without any positive tests. And now that we're in a marathon, it's obviously not a sprint, we're in a marathon here, the continual guidance from NRI has been helpful throughout. And so we're grateful for that. And I'm sorry to cut you off, Inspector.
No, that's okay, sir. And, I think we all understand that correctional health care is a very complex and comprehensive thing. And the fact that, even if you're good, and I think our medical vendor is doing a very good job, but good's not always good enough. And even if we're doing a great job, we can always do better. No one's batting 1,000. And to have someone on your side, not only your side, but the medical vendor's side, to help them complete the task and strive for improvement every day, that continued improvement, it is what's necessary to have a good healthcare program. Because if you stay stagnant and do nothing else and think you're really good, you're going to get to a point where you're not so good anymore. So the constant striving for improvement and getting better is what's important. And when the medical vendor sees the contract monitor as an asset and someone that can help them get better, and our contract monitor has helped us in so many ways, whether it be just from the auditing aspect of the healthcare records to our intake processes and procedures, which are right now improving, and we have a plan for improvement. There's so many different areas that we've looked at, and it's been helpful not just for us, but for our vendor who's doing good and striving to do better.
I would just add, if you don't mind, Brent, I think we bring you in 3 times a year.
Well, they changed the contract. They're coming in monthly.
Month on site, but they're also available remotely. And while I know we're dealing with human beings and people are going to make mistakes, but having the monitors there is a way to eliminate systemic problems in the system. You're always going to have problems because people make mistakes, but the bigger problems, the problems that will fester, I think we've been able to nip them in the bud and stop them from becoming problems that could cause deaths and unfortunate situations.
Thanks, Don. We appreciate that. We are just about out of time. During our presentation, we'll be turning to questions from the audience where we'll all be able to answer them. But I just wanted to sort of close us out by thanking all of you today for taking the time to be with us. I think one thing that's important to keep in mind is monitoring is a key concept. You've heard a lot today about what NRI, again, NRI is the not-for-profit affiliate of NCCHC. Whoever you choose to come take a look at your services, just make sure they know what they're doing, and that the activity of bringing in an expert outside person on your own volition rather than being told you need to have it done, I think is going to be very important, because when you have that collaborative relationship, it really makes a big difference. But again, I'll close us out here. We've really come to the end of our hour, but I want to thank, in no particular order, just as they appear on my screen, Inspector Aaron Dobson, Mr. Jim Voisard, Sheriff Arnel Lucas, Mr. Don Batista, Mr. Oscar Aviles, and behind the scenes, Stana and Toyin, and the whole NCCHC team for putting together this amazing conference, the National Conference 2020. We hope that you've learned something today about what is not well understood nationally, and these jails you've heard from today, and these leaders represent the cutting edge of how correctional health care works in the 21st century and beyond, in the era of COVID and beyond. And we hope more and more people turn of their own volition to monitoring again, rather than being told by someone that they need monitoring and kind of losing control of their health care, if you will, to someone else. So thank you again today. I'm going to go ahead and close us out, and we'll end here. Thank you again very much. And Toyin, we can go ahead and stop the webinar. Thank you. All right, thank you everyone. This is Brent Gibson from Chicago. We have all of our panelists here available. We have answered many questions via chat, and we're happy to keep doing that. Our host is Beth. Beth, thank you for being here. And again, another thank you to Jim, Oscar, and Aaron, who are here on the call today. Beth, a question for you very quickly. Will we be able to hear people with audio questions or just the chat that we've been doing?
It'll just be the chat function.
Okay, great. So we'll animate our answers appropriately. Let me just see here. Okay, we have a question from Ed. Can you review ways NRI monitoring may be best positioned to help a system take the findings of monitoring and turn them into effective actions to achieve quality results? Well, it's a really good question. I really appreciate that question. So I said this, there's been a lot of chat, so some of this is probably in there, the essence of this will be above. The term monitoring is what's commonly kind of understood, in particular in the procurement world, where it's when you want to get somebody looking at a contract, that's the word you use. And we use it too, but what we really also look at it is, as you've heard from the presentation today, a health services support model. So what that means is it's not a list of, here's your problems, and we're going to check in with you later and see how you're doing. It's a constant relationship, and I think we've borne that out today by having our clients, our customers on the phone with us today and giving this talk, that we don't just point to problems, we work to build solutions. And that can be any number of things from, again, I use the COVID example as a stress test of our system, where nowhere in the contract that we have signed with the county is, provide support for a pandemic, right? Nobody had that in any contract. So, but when that happened, because we're there and we know the system, we're immediately available with everybody that's on the team, plus people who are experts in infectious disease and custody. Our own staff member, Jim Martin, who many of you know, was able to come in and provide some advice to the House of Corrections. And that's kind of how it works. Then we also help systems develop their own measuring capability so they can see how they're doing. That's kind of a core tenet of the NCCHC accreditation model. This is very different over here, but they look for things like, how are you QAing your own processes? So let me then pass this question to Jim Boissard and see if you wanted to add to that a little bit more.
Thank you, Dr. Gibson. Yeah, it's a great question. We have found that the monitoring process, as has been alluded to, is not just come in with white gloves and a checklist and report all the things that aren't happening appropriately. We work in a collaborative effort. We attend some joint meetings with healthcare and custody personnel, and we actually look at the issues at hand. Even where there are some trends starting and it may not be a significant problem yet, we're able to troubleshoot and prevent some things from becoming a particular issue. We also look at processes where there's the joint, let's say, the booking intake process. It involves both a healthcare and a security component. There's a lot of different moving parts that we look at, and that all those have to work together to be able to put together a process that's efficient and timely enough to get not only the booking completed, but also get the initial health screening completed. So we actually work together to look at those processes and troubleshoot together, not just looking at it from the security perspective, but also the healthcare perspective. You have to look at it from variables. You also look at it from the patient perspective in some cases when it comes to privacy and things of that issue. So this is a much bigger collaborative effort than just coming in and checking a box as to whether you did something or not. And there are a number of areas that we picked up on also that weren't technically in the contract as far as compliance issues or concerns or stipulations in the contract, but we pick up on things that we make suggestions or recommendations to the county and or the healthcare providers, and then we are able to make even better systems for everybody involved. So it really is. It is working together. We're not there as I think it was alluded to earlier, is an adversarial approach. We don't do that. There was also a question, I think, about the interaction with court monitoring. We don't do court monitoring at these facilities, but there is a court monitor at one of the facilities. And we have found that we've been able to work in a manner that we don't step on the toes of the court monitor. We have to make sure that they're monitoring their own stipulations, but in the meantime, we're able to assist the county and the health care provider in a way that would help if there's a dispute or a question or a concern where the court monitor says it needs to be done this way. Ultimately, they have that authority, but we're in a position to be able to help take a step back and look at the process and unique aspects and parameters at the facilities we're working at, because we know, as we all know, that this is not a cookie cutter issue. So we have to have the correct expertise on the ground to be able to identify the issues and then be creative in coming up with solutions that are beneficial across the board, not just to the individuals that are the agency that's hired us to do the job. And we think that ultimately is the best approach. Everybody wins.
Thanks, Jim. That was great. There's one more question, but let me see if Aaron or Oscar want to add anything to this question.
Yeah, I think Jim makes some very good points. He was able to help us and our medical vendor quite a bit. And we do, and the medical vendor does view it as a collaborative relationship. If you don't want someone inspecting you and looking at what you're doing, then you're probably doing it wrong. And, it's good to have someone looking at those medical records and just assessing them. And if they see a problem, great, then we can fix it. And NRI did a great job of really helping us with our intake process. Our intake process here was something that was set up by the court monitor, and it was a very complex and comprehensive process, and it wasn't getting done fast enough. And we didn't believe we were going to get NCCHC accreditation potentially because of it. So working with NRA, the vendor, and security staff, we were able to sit down as a team and collaborate and find a solution. And we were able to do that and fix it rather quickly. And so it's good when we can work together as a team and have a monitor as an asset for both the security side and the medical vendor. I think we all appreciate it.
Thanks, Aaron. Oscar, any words on that? And then we have one more question.
Yeah, I just want to say that it's a collaborative effort. The ability for the vendor to be totally transparent and communicate with NRI, and NRI to communicate directly with the health services provider is very important in achieving a quality healthcare program. So, although the correctional administration of the county government is involved in that process, allowing the vendor, the medical provider, and NRI to collaborate and communicate transparently is very important. And that.
Thanks, Oscar. The next question is a great one. I love this question from Lindsay. Thank you. How difficult or easy is it for NRI to work with large corporate correctional healthcare organizations that may already have their own monitoring or QI processes in place, even if they not be tailored to that facility? It's a great question. I would also add that many counties and states have their own monitoring processes too. But I think it's fair to say that one's own monitoring, as good as it is never going to be exactly the same as an outside party coming in. It's kind of a lead-off question. The other question is how difficult or easy it is to work. We've had a really good relationship, we as an organization, with really all the vendors. We are extremely neutral, we are agnostic, and we want the quality of healthcare to be provided. I don't want to say we don't care who does it, but many people can provide good quality healthcare. Our job is to empower that and to to prevent an adversarial relationship from developing between the client and the vendor. It's not an official stated purpose, but I mean, healthcare is hard. I had a call this morning on a totally unrelated thing, and you see doctors arguing with each other about the quality of care and who's right and so forth. And it's a tough environment, and we all need to keep our heads together and provide good healthcare. And we can because we're not in the mix every day, we can take a step back and look at that quality. But let me stop there, and then Oscar or Aaron, maybe some comments about the vendor relationship issues.
We really haven't had any issues. I think, one of the big things is the reports that we get. And I think they're really beneficial for us on the security side, because we want to show our county government that we're getting what we pay for, because the government is what authorizes the expenditure for such an expensive program. So it's beneficial for us to have that. And it's, you know, great for us. I mean, I get complaints on the phone sometimes from an upset parent or family member that are upset about the healthcare they're receiving. So do I want to ask the person that the complaint is being made on, or is it nice to have someone that's an outside entity that can have that outside view and really tell me the honest truth? And it's really great to have that. And again, our vendor has been appreciative of the fact that I think it provides them a sense of security as well when you have, you know, a third party saying that what you did was okay. And again, it's great to have that third party to find something wrong and to show that you're willing to fix it if it is found. I think that provides a great amount of relief, and everyone looks forward to reading those reports and getting the reports and seeing progress that's been made. It's been very beneficial for us to be able to show that.
No, I agree. And I mean, initially, the vendor NRI relationship was a little questionable in the sense that, you know, a lot of folks don't want people looking over their shoulder. However, I can say that it evolved into a relationship where the vendor appreciates what NRI brings to the table, because it's impossible for the leadership of the health services provider to know exactly what everyone's doing at all times. And there are things that NRI catches that the vendor may not, as it relates to individuals that perform under the contract.
Thanks, Oscar. And sometimes what we find isn't the way we want it to be, and we have no problem saying that. But that's sort of preventive medicine in its essence, right there. Is there's a change or something in a program that increases the risk for a bad outcome. So let's address that right now, so that you don't have a bad outcome. You know, and it can be a variety of things. And I would just say that you know, we see it all out there, and we're real grateful for the forward-thinking counties of Hudson and Milwaukee, two very, very different places of really looking to our services, if you will, and making a difference. And the feedback we get from vendors is very positive. Is it positive as it can be when you know, when your work is being looked at, but it's never adversarial. Okay, I see we've hit the 5-minute warning, and again, I see some good friends and colleagues in the chat here, Dr. Ed Kern, Kramer from Delaware, Ed from Alabama, and many, many other people. So I think we probably have time for one quick question, and then we'll close it out. If there is any, if not, we can close it out now. I'll leave it open. All right, well, hearing none, we appreciate it. You can reach out to us at NRI directly via email, and we appreciate it. It's been a real pleasure to spend time with you today. Thanks so much.